The Department of Health and Wellness, in a press statement issued on Wednesday, says it continues to monitor the alerts issued by the World Health Organization in relation to a new strain of coronavirus discovered in central China. The virus has been linked to respiratory tract infections in China, and according to WHO, current evidence suggests that person-to-person transmission is limited. The WHO held an emergency meeting in China on Wednesday.
It is still very early days, to characterize the full extent of this human-to-human transmission. What we're hoping for from our Chinese colleagues, and also from any countries that have an exported case or a case imported into their country, is to look for onward transmission. What level of secondary transmission amongst close contacts exists? We haven't seen any secondary transmission from any of those exported cases, and that is quite important. Within China, we've asked our colleagues in China to further explain to us what they're doing to better understand the extent of infection in Wuhan, but also in other parts of China. And then, importantly, amongst those cases that they've identified, how many of those are related to human transmission, and then in what context did that human-to-human transmission take place? Was it in a household? Was it in a healthcare facility? Was it in the community? So those are critical pieces of information that we need to know to be able to characterize the full extent of transmission.
The Ministry of Health says as of Wednesday, January 21, 2020, the virus has spread to at least 4 other countries, including the United States of America. Due to the novelty of this virus, the World Health Organization and other international partners continue to investigate and provide guidance to the international community. The Department of Health and Wellness says it also maintains communication with regional partners and will continue to provide the public with information as it becomes available. In the interim, the public is asked to continue practicing the standard recommendations to prevent the spread of infection. These include regular hand washing with soap and water or alcohol-based hand sanitizer where soap and water is not available. Cover mouth and nose with disposable tissues or clothing when coughing and sneezing. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. Seek medical attention and share your travel history with your healthcare provider if you have symptoms suggestive of respiratory illness either during or after travel. For more information, please contact the Office of the Chief Medical Officer or the Epidemiology Unit at 468-5099 or 468-5325, respectively. Joachim Duplessis, HDS News Force.